Hello and good morning, everyone. We welcome you today on a session, a very interesting topic of period pains and pain after intercourse, what we need to know, brought to you by Apollo Cradle. To speak on this topic, we have a renowned speaker, Dr. Sheetal Sachdeva. She's an internal consultant as an obstetric gynecologist and a laparoscopic surgeon and fertility specialist associated with Motinagar Center of Apollo Cradle. To give a brief background about our speaker today, she has done her MBBS, DGU, and DNP, and she's a fertility specialist here. Today's topic is quite interesting, and I'm sure many of us would want to know what exactly and what we need to know about it. So, Doctor, we're looking forward to hear from you. It's all yours.
Yeah, sure, sure.
Thank you.
So a very warm welcome to all. And today we'll be sharing, as a gynecologist, our views and our suggestions with regards to how to deal with the period pain and pain after intercourse. So, starting with the period pain or the menstrual cramp. See, why does it happen? When the periods occur, they are usually because of the shedding of the endometrial or the uterine lining from the uterus. So once that blood is shed, it's not dirty blood, it's absolutely normal. That lining is formed by the body in preparation for pregnancy. The body doesn't know whether you want to get pregnant or not get pregnant. So, that access when it gets stimulated. So the lining is formed. And at the end of the month, when the body realizes that pregnancy never happened, so it sheds that lining. Now, when that lining is shed, then sometimes due to the presence of certain prostaglandins or other chemicals as well, there could be menstrual cramps. The uterine contractions are stimulated, and that can lead to pain during periods. Now, broadly, there are two types of pains. One is the primary, and the other is the secondary. We call it dysmenorrhea, the period pain. So, the primary dysmenorrhea is usually seen in teenage girls or young girls who have just started off with their periods, and the pain is present mostly during the time of the periods, and as the flow decreases, so does the pain. And the contractions can lead to sometimes little clot formation also. Now, why the clot forms? Because it's the uterine cavity and it tapers down into a narrow canal, which is called the cervix. That's the mouth of the uterus. So when the lining is shed from all the walls, then that blood collects at the mouth of the uterus. Imagine everybody is trying to rush from the emergency exit. So all the people, there'll be some crowding at the exit if there's one door only. So once that blood collects over there, so due to prostaglandins and chemicals, there's slight clot formation. And the uterus, being the uterus itself, it tries to contract and expel it. And that's why you feel the contractions, you feel that spasmodic pain. And the good news is that it improves with time. And when the elders say ki once you get married and once you have children, it'll improve. So there's certain logical sense, there's certain scientific sense to it. I would not say after marriage, but yes, after vaginal delivery or once you go into labor, then that mouth of the uterus slightly softens and it opens up. So many a times we have seen that after childbirth, patients do experience lesser pain during your periods. So that would be the good news. And the treatment, how to deal with it. I'm sure many of us have young daughters at home, or we ourselves are experiencing those pains. If you are younger than me, then the painkillers is the way to go from our end. I, as a gynecologist, don't believe that you have to torture yourself or your daughter, that no matter what, you're not going to take any painkiller. See, it's not a habit forming medicine. It's not an addiction, that you cannot even take a Crocin or any painkiller, nothing of that sort. I mean, be reasonable. If it's the part of the body process, if it is natural, you have any doubt, you consult a gynecologist. That if there are no other problems with your daughter or with yourself, then painkillers, antiprostaglandins like maybe Voveron, Meftal-Spas, Crocin, you start off with the lighter medicines. And I'm sure that most of the times the patients, they have relief in the first couple of days. And in case you have to take 2-3 tablets in a month, to just get through it, why not? I'm okay. I'm absolutely okay as a gynecologist if a patient of mine takes it, provided I have evaluated her once to assure her that nothing else is there. Apart from that, you should try relaxation techniques. You should keep yourself well hydrated during those days. You can use hot water bottle. You can use a heating pad. Those help, and take a healthy diet also. Also, cutting down on extra salt helps you, because when you cut down on the extra salt, then that water retention and the bloating sensation is also less. So it helps in the periods. One thing which I've seen as a doctor, is that when you have calcium supplementation and vitamin C supplementation, it also helps indirectly in reducing the period pain. So you can try it from your end. Now, second is the secondary dysmenorrhea. Secondary dysmenorrhea is that there might be some underlying disorder due to that. Just so in those conditions, it usually happens a little later in life. You've been pain free during your periods, and suddenly, over the period of past few months, you have started experiencing pain as well. So that pain can be usually premenstrual and postmenstrual as well. It is not just confined to the time of the periods. It can happen before and after as well. So, and it might be maybe accompanied by erratic periods. You may have noticed difference in the flow pattern of your periods. They might be a little early, might be delayed, might not be having proper flow as you would have expected in the past. So now, if the periods were earlier normal, but now they're painful, then you should see a gynecologist. Usually, we come across conditions like fibroids or endometriosis. So just get yourself evaluated, and it could be related to certain infections also, pelvic inflammatory disease, the PIDs. So this would be the secondary dysmenorrhea. So depending on our evaluation and what we come across, what findings do we have, we suggest you further treatment with regards to that. So in a nutshell, when to seek medical help, that should be when you have used painkillers and self-care, but it doesn't help you any longer. Second would be if the cramps worsen over a period of time. Third would be that you're more than 20, 25, and you still get severe cramps. Fourth would be fever and the period pain. Fever with the period pain, of course. And pain, if it is there, even when you are not getting your periods, that's also a condition when you should be consulting a gynecologist. So that would be it about the period pain. Now, coming to the second topic of the day, the pain during intercourse. We call it dyspareunia. So now the sex is supposed to be a pleasurable feeling, but it can be very painful for many females. So that pain can be it can be during or after sex. So, and the pain could be in the vagina, or it could be deeper in the pelvis as well. So the person might experience sharp pain during penetration, or there might be a throbbing pain or aching after intercourse. Some patients complain of burning sensation in the vagina after relations, or there might be some pelvic cramping. Some people experience difficulty while passing urination after intercourse. So there could be various, the pattern could vary among different females. Then the main causes are that if we call about pain in the vagina, the main causes would be mostly it's associated with the infections. Those infections could be fungal, it could be the chlamydial, gonorrheal, genital herpes. You don't have to worry about which infection it is. Don't self-diagnose. Let it be the call of your attending doctor as to what sort of an infection after the evaluation does she share with you could be a possibility. Second reason for the pain in the vagina could be if you are perimenopausal or menopausal. When you are approaching menopause or you're already menopausal, then the problem of dry vagina could be there, and that could be one reason that you might experience pain. Third would be the lack of the sexual arousal. If there is insufficient foreplay, then that could lead to lack of sexual arousal and can lead to pain after or during intercourse. Third, the next would be vaginismus. Now, vaginismus is when you clench the muscles of your pelvis in and around vagina, they shut tightly, which makes sex very painful or impossible. The partner cannot penetrate. So that is called vaginismus, when there is instant clenching of the muscle. So we'll discuss about the treatment a little later. And another reason for pain in the vagina could be genital irritation or allergies, which could be due to latex allergy of the condoms, or it could be because of the use of certain spermicides which are not suiting you. So those allergies can lead to pain during intercourse. Another would be that recent delivery, you have recently delivered and there have been stitches down there, episiotomy, and that can lead to pain during intercourse in the initial phase. Another would be psychological issues, some incompatibility on physical, mental states, then that could also lead to pain during vagina, during sex. Second type of pain is the pain inside the pelvis. After penetration, you feel that it's not during the entrance, but it is after penetration that you experience the pain. So the main causes among those would be the pelvic inflammatory disease, the infections deep down, endometriosis, that's one of the hormonal imbalance due to which the anatomy in the pelvis is distorted, and that can lead to, there are certain adhesions, and that can lead to pain deep, deep in the pelvis. Another would be the fibroids. If you have fibroids in the cervix or in the lower part of the uterus, then it can lead to pain as well. Another would be irritable bowel syndrome, and the constipation also can lead to pain in the deeper pelvis after sex or during sex. So, with regards to management, first of all, don't self diagnose. You have to understand that um, not everything is normal, not everything is obvious, that if it is hampering the quality of life, you have to seek medical help. You should seek. So when you come to us with the pain, discharge, we always ask you, whether it's associated with discharge also, itching also, soreness down there. Then we evaluate, we assess you, and we treat you with antibiotics, antifungal, anti-inflammatory. Let it be a call of your attending gynecologist once she assesses that how to take care of those situations. So don't take over-the-counter medicines for that. Let yourself be evaluated first. Second condition would be the dry vagina. So in case dry vagina is there, so that can be helped with the use of the lubricants. So there are certain water-based lubricants which are available, and that can be used. Another would be that you can try a position which would be different from the usual one that can cause less pain. There are certain positions during intercourse that might be more painful for you. So avoid those. Then look for the allergies and the causative culprits like spermicides and the latex. So if you think that you are allergic to it, then go for an alternative method of contraception. Now, if there is any emotional reason or anxiety, then you should seek counseling and guidance also. For the menopausal ladies who experience dryness, we have certain creams available. Those are the estrogen creams, and after evaluation, we advise you to apply it in the vagina. So those would be the local measures which can help in decreasing the dryness and improving the sexual relations. Now, if a very common problem is that the ladies say that they experience UTI, urinary tract infection, after sex. Now, in that case, first we ask the history, that how recently you've been married for, or how recent you have started your sexual activity. So we do believe that once you start your sexual activity, so that leads to small cuts in the vagina, and bacteria get an easy access to enter the vagina. So we have a specific term for that also. That is called honeymoon cystitis. That means that many times we get newly married couples who say that they've recently married and now the lady is experiencing difficulty in passing urine and burning and all. So not to worry, it's something which is very common, and we carry out certain investigations and then we advise the medication, and with over a period of time it improves. Now, another thing which I want to focus is that once these things happen, you should always get the blood sugars checked, especially if it's an infective etiology. Get the sugars checked for both yourself and your partner. Get a urine examination also done for both yourself and the partner if you're experiencing frequent UTIs. And also ask your partner if he has been experiencing any problems during or after relations, any redness in his private parts, and he should seek medical help if needed. We have a common course of antibiotics, and in case somebody gives a discrete, very distinct history that after relations she experiences UTI every time, then we can have nitrofurantoin or any antibiotic which is given after sex as a prophylactic measure, but that is only after evaluation. So always remember to treat or give the prophylactic treatment to the partner as well, involve him also. Now, another situation which I said I'll be discussing now would be the vaginismus, where the lady clenches her muscle. There, the fever of the unknown plays part on your psychology. You might feel that there would be trauma, there would be too much of bleeding, and that fear plays on your mind. You've heard the stories from your family and friends, and you feel ki, there would be some. It would be a totally traumatic experience for you. So that psychology plays the role, a big role on on occurrence of vaginismus, the clenching. So first of all, when you come to us, we examine you. We examine you internally to know whether there is any problem down there. We do a one finger or two finger vaginal examination, and once we are assured that yes, anatomically there is no defect down there, we reassure you, and then we suggest you certain lubricating creams, certain vaginal dilators or positions to relax the pelvic muscle. And most of the times it helps, and in more than 90% of the cases, patients are able to then consummate the marriage. Now, if there is any evidence of endometriosis, then depending on the age, fertility, the other symptoms, then we decide about the medical or the surgical intervention. So that for that one has to be reassessed. So in the end, I would like to say that pain during sex can lead to physical discomfort and emotional distress and loss of intimacy. So if the sex hurts you, then contact your healthcare provider. Do not feel embarrassed and treat the problem so that you can help your sex life, your intimacy, and confidence. So I hope this all helps you. Take care. Bye. So if you have any questions, we would be happy to answer.
Ma'am, you have covered most of this, but there are only two questions which I would just want to ask. One is, when it comes to period pains, are there any other home remedies that would suggest to relieve pain slightly before coming to a doctor?
See, I feel that as a doctor, that once what I have seen among my patients is when they take something cold like ice creams or something which has a lower temperature than usual, it aggravates the pain. And warm soups, hot water bottle, जो कहते हैं हम गर्म तासीर की चीजें होती हैं, they help, but not in overtly measures, because everything would have its own pros and cons. You take lot of ajwain, lot of zira, lot of garam things that can have an impact on your bleeding as well. See, and the other thing is I'm an allopathic doctor, so I would be focusing on the medicine wala part. With regards to home remedies, yes, you can listen to your family and you can try one or two odd measures, but don't bank on it that in case the pain is increasing, then don't ignore it. You should see us.
Okay. Ma'am, it is said that pain during periods is related to good flow. Is it true?
No, no. I would say, per se, if we talk about pain during periods, we have seen that it is during the ovulation. It is in the ovulation cycles mostly that it is associated with period pain. So if there is a patient who comes to me, if there's a couple who comes to me with the problems of infertility, and she says that her periods are absolutely painless, she gets periods after 30, 40 days and they are without pain, then that would raise my antenna that it might be an anovulatory cycle. Matlab, ovulation is not happening. And if she says that she has her regular periods and she has mild pain during periods, then in my mind, I would think that most likely ovulation is happening. Now, coming to the flow. Now, as I said, that when I explained in the beginning, that when a young lady experiences certain clots in the flow as well, then it is part and parcel of the flow, because that blood collects at the mouth of the uterus and can lead to certain clots. So you might experience less flow in that situation, and once you have contractions, that clot comes out and you might just see one clot thinking that you haven't had your proper period, but it has. Still, if somebody complains of less flow during periods, then we get an ultrasound before the periods just to say that just to see that the lining is adequate or not. If the lining is fine, it is along the expected thickness, then we reassure the patient that don't worry, whether the flow which you have experienced, which you may have experienced over the last 5 days, but now it lasts for 3 days only, then it is part and parcel of the body's mechanism. It can happen, and then we reassure and we don't give you anything. And at the same time, thyroid, prolactin, those are the two hormones which we assess if somebody complains of decreased flow.
Okay. Ma'am, one last question. I guess you've answered this, but someone has wanted to know that after how many times of experiencing a pain after intercourse should they see a doctor? So you said that we
Okay.
need to go and meet immediately, but is there a number you seeing it for a week, month, and
There
then
is
visit?
no specific, there is no specific number. If you have recently started the sexual activity, then you can give yourself 3, 4 attempts at least, before seeking medical care, because it will take some time if you have recently started a sexual activity. But if it's been more than that, definitely. And now, recent is a very relative term, right? If somebody is having sexual relations once a month, then I'm not going to ask her to come after a month. So I would say ki 4, 5 attempts and still you're not able to do it, then come to us.
Ma'am, thank you. Thank you so much. No more questions. It was a wonderful session, and you have covered everything. I mean, in a short span, you have
Thank you.
covered many things that. So, thank you once again, and have a good day. I'm sure everyone must have
Thank
enjoyed
you.
and learned a lot from this. Thank you.
You
I'll
too.
end the
Thank
talk.
you. Thanks. Okay, pleasure.